Hello, dear guys. Dear students, today we continue our set of lectures in pathology. Today will be pathological anatomy lecture about tumors. So, what are tumors and how we define the tumors, and especially today we'll classify them and we'll discuss the main morphological patterns of tumors. Take a look. Okay, here in this book it's about United States. But everyone know what is a cancer. Everyone knows what is a was this, everyone heard this diagnosis, at least heard this diagnosis, and you know that it's one of the main leading cause of death. And as more countries evolved, as more cases of death from tumor we have. That what I want to pay your attention. So you know that everyone is so every person will die. So everyone is waiting for its death, and when person dies because of different reasons. And leading cause of death right now it is cardiovascular diseases. 1 century ago it was infectious diseases. And more centuries ago, so I mean in ancient period, it was just death of trauma. Yeah. So because when we were ancient people, so when Neolithic or even in Iron Age, so we were so first cause of death was just injury. So it might be injury by predators, injury by other person, other people population, so you see it, and approximately people live so not more than 30 years, not more than 30 years, and that's why the genes which are responsible for to keep our life, to keep us alive, they are not shared in population. And most successful successful genes, they are genes which can be spread faster than others. Yeah, and we are ancestors of this distribution, and that's why genes which are acting after 30 years, they are very commonly injured. They very commonly possess some changes which can cause some diseases which we used to, which we are treating right now. And one of these genetic disorders are responsible for tumors. You remember we discussed a little bit in the first lectures, in the first set of lecture, that we have some genetic predisposures to some diseases, especially tumors. And you remember that every cell division is related with some genetical changes. Yeah, every cell division is followed with some mutation. At least little mutation happens every time. But usually these mutations are not injurious, not dangerous. Usually they are not related with some genetic lesion. But anyway, so if we have at least 0.1% chance of these changes, so it will happen in because we know there are a lot of cells in our body. And there are numerous amount of cells in our body, and that's why in one of these cells, in one of these dividing cells, we have this lesion. Okay. I want to remind you that most of our cells, they have some restriction in cell division, and this is made by telomere. Yeah, you remember that during every cell division, telomere gets shrinked, and we discussed the mechanism of it. But if cell division, but we have specific enzyme which is known as telomerase, which build up a new telomere sequence, and which allows us to divide more and more times without interruption. This is normal mechanism of differentiation, and so stem cells, they have a very large telomere with a telomerase enzyme which allows it to divide without interruption, and so divide it without limitations. So, but how is it related to cancer? So how all of these events are related to cancer? So cancer is usually, so I point your attention, usually. So we usually is related to disease of elderness. So usually oncological diseases are typical for elder patients, elder than 40s, 50s, 60 years. So because all mechanisms which prevent the tumors, they were working in that time. So in younghood, so in a time when we are predisposed to share our genes, when we are when we are able to share genes, so to produce ancestors. But now but a lot of mechanisms get impaired. So this okay. And now, and actually, we have a lot of different types of tumors, and let's classify them. That's For this we have nomenclature. So this new growth, neoplasia. That's name of our topic. It's named as new growth. It's a new growth, and this neoplasia, it's a process known as a new growth. Neoplasms, it is a result of this growth. It's a tumor. Yeah, neoplasms or tumor. And tumor, it's originally is a swelling caused by inflammation, but now it's more commonly equated to neoplasm. So because ancient doctors, they can differentiate, so what is inflamed, what is the real tissue. They had no histology subject before. Okay. And study a medical study which learn about the so please, Muhammad Ali, please sound off. Okay, and study which is responsible for, in study of neoplasms is known as oncology. Onkos, from Greek word, it's sometimes, as I said, it's tumor. Also, onkos, it's protein. So that's because actually fish protein. So that because most of tumors, when Greek doctors removed these tumors, when they cut it out, so in a section it looks like fish meat, and that's why onkos. So it's a protein from Greek, also tumor. So according to other source, and that's why it has this name, oncology. So we study about these tumors. Okay, physicians know what they mean when they use the term neoplasm. It has been difficult to develop a precise definition. So you see, it's hard to explain what is neoplasia. So you can say that neoplasia, it's when growth occurs in that areas which it's not it shouldn't be there. That's neoplasia. Okay, we divide. So all tumors are composed of two components. It might be neoplastic cells and also reactive stroma. Yeah, so cells which causes tumor, but it's not it does not it cannot. So you see, cells require nourishment, and that's why for nourishment of the cells, they must to facilitate the stroma of that organ. So every tissue requires stroma. Yeah. So Akib Khan, you're the last one who was allowed to the lecture. Everyone else, every next student who will try to join, so they get absent. Okay. Uh, so connective tissue, blood vessels and cells, adaptive and innate immune system, blah blah blah. Okay, you see that neoplastic cells and stroma which maintain these cells. Okay. Sometimes in some tumors, connective tissue is scant and the neoplasm is soft and fleshy. In others, parenchymal cells stimulate the formation of abundant collagenous stroma referred to as desmoplasia. So that's we discussed it a little bit in healing. Yeah, some desmoplastic tumors, for example, some cancers of the female breast, is a stony, hard, or skyros. So that's that will be discussed in female genital tract tumors. Okay, benign tumors. And first of all, of course, everyone heard about benign tumors and malignant tumors. So what is benign tumor? What is malignant tumor? And it seems like a very easy definition. So what's the difference between benign tumor and malignant tumor? So benign is not cancer, malignant is cancer. Yeah, so we used to think like this, and every single person of the world heard about that it's benign tumor and malignant tumor. Benign tumor doesn't cause death, and malignant tumor causes death. But classification is a little tougher than it seems like. Actually, it's this definition I said before is very root oversimplification. It's very root oversimplification, and we need to discuss it in much details. Okay, benign tumors remain localized their site of origin and are generally amenable to surgical removal. So, and this generally amenable to surgical removal, so it's every day it changes because quality of surgeries are improved, and some of tumors and some of malignant tumors can be surgically removed. Yeah, so that's why this part can be wiped out from the definition. So that and one definition which remains so long of time, it's benign tumors remain localized at their site of origin. So that's my main point, because opposite to this, malignant tumors, they can invade and destroy adjacent structures and spread to distant sites, metastasis. So, and malignant tumors are usually metastatic tumors. But we must to differentiate. So which tumor is tend to be metastasized, and which malignant tumors. Which of this is just benign tumor? You see, if we can if we differentiate benign tumor and malignant tumor by possession of metastasis, so a lot of cancers. Which will produce metastasis, so will be remained untreated, and that's why we need to differentiate it in better way. So when which tumors they can invade, they didn't invade yet, but it can invade, and that's why we need to treat it before it invades. So that's the main differentiation we have to know. Okay, let's talk about benign tumor. So which typical features of benign tumor you know? So usually so it reflects in the name of these tumors. They have suffix oma. So you heard about this OMA. For example, it's fibroma, chondroma, adenoma, papilloma, and cystadenoma, and a lot of other names. So we'll encounter very soon. But if it has suffix OMA, it means it's benign. Yeah. Okay. Fibroma. Fibroma is a tumor of fibroblast-like cells. It's benign tumor of fibroblast-like cells. Mhm. So 1 minute. So who is typing right now? So fibroma, it's a benign fibroblast-like cells. So when fibroblast-like cells, they produce fibers also, and you see, these cells are very well differentiated. The white cells of tumor, they remind the normal cells of this area. So the fibroma is composed of fibroblast cells and or fibroblast-like cells. So and this. And benign cartilaginous tumor, for example, chondroma. Yeah, so when cartilages are when chondrocytes or chondroblasts are overproduced and they still producing the same features. That's main idea. That benign tumors, they act like normal tissue. They act like normal cells, and they have most of features which are typical for normal cells. And okay, let's talk about another adenoma. Adenoma is a benign epithelial neoplasms. So usually it's derived from glandular tissue. So adenoma is glandular tissue neoplasia. So some examples we will discuss later, but adenoma so is very common because it's mucosal surfaces. Usually it's present on mucosal surfaces or just entire tumor, entire gland can be involved in adenoma. Like best example here, it's adenoma of prostate gland. Yeah, so adenoma of prostate gland. So it's normal neoplasia. It's tumor, but it's benign, so it never causes a spreading of this tumor. Also might be papilloma. Papilloma, so it's usually promoted by papilloma virus. Projection, it's composed of projections of epithelial surfaces. It's finger-like or warty projection, so it's known as papillomas. So now we know that papilloma are made by papilloma virus, but before it was just like one more tumor in our body. And for example, but formation of cystic masses, it's known as cystadenomas. So, for example, cystic masses like cysts, it's um, it's like okay, bubble of filled with liquid. Yes, so this can be named as cystadenomas. Okay. Uh, Okay, but if we have a mucous layer tumor, so which is present on mucous layer, it resembles papilloma, so it names as a polyp. Polyp, it's a glandular tissue, is called an adenomatous polyp. It's derived from adenoma. Okay, but what is and you cannot you can see here that benign tumors are innocent. No, benign tumors are not innocent. Some benign tumors they can cause death. They can cause very hard diseases. For example, adenoma of pituitary gland. So it can produce some hormones which can disrupt the normal function of the body. Same adenoma of prostate, so it causes very hard complications, which later might cause also it might cause death. And also tumors of brain, so any even benign tumors of brain, so they cause a mass effect in brain and cause a disruption in brain functioning. And that's why we can't claim that benign tumors are innocent. So we need to treat them. Some of them must be treated. So some of them not must be treated, but some of them doesn't shouldn't be treated. We just need to observe it and control it. But let's talk about malignant tumors. Malignant tumors, so as I said, it's they can invade and destroy adjacent structures and spread to distant sites. So you see, malignant tumors. So main mistake everyone makes in practical class about malignant tumor, benign tumor. So about malignant tumor. So you said you put the equals between malignant tumor and cancer, but it's not. It's not. So here it's written. So even here it's written, and that's why this sentence is wrong. So malignant tumors are not all malignant tumors are cancers. Cancers are epithelial tumors only. Only epithelial tumors are cancers because cancer is derived from word carcinoma. Carcinoma. It's carcinoma. It's a malignant growth of epithelial cells. Epithelial cells. So that if you have tumor of epithelial cells or epithelial-like cells, they are cancer in origin. But if it's growth of mesenchymal cells, for example, so like connective tissue, it is not known as cancer. It is known as sarcoma. So sarcoma is growth of connective tissue. So this I will repeat it again and again. So a few times during the lecture I will repeat it. Cancer is epithelial cell malignant tumor. Epithelial cell malignant tumor. So sarcoma, it's a malignant tumor of mesenchymal cells. That's main difference. That's why, remember, cancer is epithelial cell tumor. Yeah, epithelial cells are most commonly became malignant. So unlike muscles, unlike connective tissue, unlike yeah, that's enough. Unlike nervous tissue, actually, it's also very rarely become malignant. The epithelial cells are, because malignant cells, they have properties of division, and they keep this genes of cell division, because most of cells, like you remember the division of cells, yeah. We have stable cell population, we have static cell population, and we have labile cell populations. And labile cell populations, they are epithelial cells, and this usually epithelial cells we say about labile cell population. And labile cell populations, they are able to become malignant. This causes a cancer. Okay, and usually when we hear the cancer, it is always related to death. Yeah, so you think it's death. And actually, a few years before, a few years, so I mean a few decades ago, almost every cancer was could not be treated, and cancer is just like death prescription. Yeah, so if you hear cancer, it means you will die. But now a lot of techniques are evolved, and we will discuss some of them in this set of lectures in about neoplasia in pathophysiology, so how we can avoid it. And now we have a lot of good ways of treatment. Okay, nomenclature of malignant tumors follow essentially the same schema used for benign neoplasm with certain additions. Okay, sarcoma. So it's a sarcoma. It's mesenchymal tissues. It's a tumor of mesenchymal tissues. Okay, tumor of blood forming cells is leukemia. Leukemia. So usually it's white blood cells tumors. It's leukemia. And lymphomas. Lymphoma, it's a growth of lymphatic cells. And I hope you remember the previous semester histology, blood formation discussed, and that you remember we have myeloid branch and lymphoid branch of hematopoiesis. And these tumors which are derived from myeloid branch of hematopoiesis, they cause the leukemias. And this part which derived from lymphoid branch of hematopoiesis, they are known as lymphoma. So because they're very different in appearance and very different in manifestations. Malignant neoplasms of epithelial cells origin are called carcinomas, and this only can be named as cancer. So now it's now in mass media you heard about blood cancer. Yeah, you heard about muscle cancer. You might heard about it. It's wrong definitions. It's made not by doctors, and you as a doctor must to correct it. You must to follow the proper definition of this. So carcinoma. So cancer is carcinoma, and carcinoma is only epithelial tissue, epithelial cell origin tumors. Mm, okay, carcinomas also they're classified inside. So you remember we have squamous cells. Yeah, epithelial cells. We have some cells which are squamous cells. And this is known as squamous cell carcinoma, which appears like stratified squamous epithelial tissue. So it resembles certified squamous epithelium, and we have adenocarcinoma. Adenocarcinoma, it's a neoplastic epithelial cells grows in a glandular pattern, so they grow like a gland, and we already discussed it. Adenoma and adenocarcinoma, they have very thin, very teeny tiny differences, which we must to differentiate. You must to differentiate to define the proper diagnosis. Okay. So for example, sometimes, yeah, so when we name this tumor, so we must to add the location of it. So for example, it's yeah, renal cell adenocarcinoma or bronchogenic squamous cell carcinoma. Yeah, so this we need to show the location of it, because we have different types of adenomas, we have different adenocarcinoma, we have different types of squamous cell carcinomas. So that's why we need to figure it out. But sometimes 2% of cases, cancers are composed of cells of unknown origin and must be designed merely as undifferentiated malignant tumors. Sometimes it happens. So when we cannot recognize where the cell came from, so we should use a very very bad definitions like undifferentiated malignant tumors. And as more undifferentiated tumor, I'll explain later, but now I want to point it. So as more undifferentiated tumor, as less treatable is it. So as the less chances we have to treat this patient. So let's talk about mixed tumors. So in neoplasms, parenchymal cells closely resemble one another, but in some types of tumors, more than one line of differentiation is evident, creating distinct subpopulations of cells. So you see that we have some tumors which are present not only of cells of tumor, but also so few cells are getting changed. So usually it's related to some hormonal changes, or might be some embryonic disorders. So in embryonic or it's not non-acquired reasons we have. For example, it's pleomorphic adenoma. These are tumors which are composed of cells from a mesoderm, endoderm, or ectoderm. It's in the great majority, but exception of tumor. So when it's mixed up, it's known as teratoma. So it contains recognizable mature or mature cells or tissues belonging to more than one germ cell layer. Sometimes it's all three layers. So you remember embryology, a little bit you remember embryology, that all cells of our body are derived from one cell. And some of the cells, if you remember primitive streak, it is a site where all of the cells, all the and the future future mesoderm, future ectoderm is collected in one place. And these cells of primitive streaks, they are undifferentiated cells, and some of them remain undifferentiated. And usually these teratomas are made by cells which are remained in this position, which are remained in primitive streak or in embryonic body. So, for example, usually this usually present in ovary and testis, and sometimes found in abnormal midline embryonic breasts. Okay, what is teratoma? So teratoma, so as it's shown here, it's ovary, and inside the ovary we have a tumor which is composed of what? What is it? It's a tooth, it's a hairs, it's a some epithelial lining, some mucus here. So you see, it's a very uncommon structure here. You remember that ovary is derived from mesoderm predominantly, but here you see typical ectodermal originated tissues, and this is typical teratoma. So its name is dermoid cyst. Dermoid cyst from word dermos, yes, so it's a skin. So in skin derivates are present there. Sometimes, so as you can see here, lined by squamous epithelium that is replete with hair, sebaceous glands, and tooth structures. Okay, and other one is hamartoma. So what is a hamartoma? It's ominous sounding terms are applied to some trivial lesions. Disorganized masses composed of cells indigenous to the involved tissue. So let's talk about the here. It's known as most hamartomas have clonal chromosomal aberrations that are acquired through somatic mutations, and on this basis are now considered benign neoplasms. So that's okay. Examples we'll discuss later. And choristoma is a term applied to a heterotopic misplaced rest of cells. Small nodule of well-developed, normally organized pancreatic tissue may be found in the submucosa of the stomach or small intestine. The term choristoma suggested a neoplasm imparts a gravity to this lesion that far exceeds their actual significance. So it's you see the difference. What is choristoma? What is hamartoma? Yeah. hmm So, characteristics of benign malignant neoplasms. So, which characteristics we need to remember? Yeah, this diagram. So, please, table number 7.1. It's in Robbins and Catran, and also the same diagram is present in just the Robbins basic pathology. So you see, here it's shown tissue of origin. It's connective tissue or derivates. It might be named fibroma, lipoma, chondroma, and osteoma. And you can suggest, yes, so fibroma, it's a growth of fibroblasts. Lipoma, growth of adipocytes. Chondroma, it's a growth of cartilages, so cells of cartilage, chondroblasts. And osteoma, it's osteoblasts, growth of osteoblasts. And it's benign tumors. But here we have malignant tumors. Fibrosarcoma, same as fibroma, but with malignancy. Liposarcoma, it's the same as lipoma, but with malignancy leading. Chondroma, so it's a chondrosarcoma. Osteoma, osteogenic sarcoma. You see, these terms you have to remember. And so what's the difference between osteoma and osteogenic sarcoma? We'll discuss soon. So actually we'll discuss in next lecture, next pathological anatomy lecture. Vessels and surface coverings. So in blood vessels, growth of so benign growth of blood vessels is known as hemangioma, and usually so it's very common finding in liver, for example, and hemangioma. It shouldn't be treated, but still it's present. But sometimes the same hemangioma, in very rare cases, it causes a death. It's causing the angiosarcoma. So then lymph vessels, so lymphangioma and lymphangiosarcoma. So very easy to remember. Lymphangio, yeah, lymphangio, it's a lymph vessel, and oma, you remember tumor. Lymphangiosarcoma, it's a connective tissue. And it's causes the formation of lymphangiosarcoma. Mesothelium is derived from benign fibrous tumor. So it's known as benign fibrous tumor. And sometimes in malignant cases, causes mesothelioma. Brain covering. So you see, mesothelioma is always malignant. So that's why even name OMA here, it doesn't reply to you that it's benign. It's malignant. So it's exceptions. So we have few exceptions here. We'll discuss now. Meningioma. Meningioma, it's a growth of meninges, brain coverings, and it might be just meningioma and might be invasive meningioma. And that's what I talked to you about. Yes, that meningioma. So it seems like innocent, but anyway, meningioma is suppressing the parts of brain, and it causes changes in brain structure, which can cause some pathology in brain. And we have invasive meningioma. Invasive meningioma, it's when these cells of brain coverings, they start to invade the brain. Of course, it causes death much faster. Okay, hematopoietic cells, they cause leukemias or lymphoma. So, and here you can ask me, so why don't we have benign tumor of hematopoietic cells? We don't have benign tumors of hematopoietic cells because it never located in one area. You see, definitely white blood cells and all the white blood cells and lymphocytes, they cannot store in one location. They are spreading tumors, and they easily can be spread all over the body. That's why we have no benign tumor of hematopoietic cells and lymphoid tissue. Every tumor of hematopoietic cells and lymphoid tissue is malignant. That's the first thing I want to memorize you. Muscles. Smooth muscle tumor is known as leiomyoma. striated muscles is rhabdomyoma. So that's the difference. So actually, and malignant tumor, very rare condition, leiomyosarcoma, and striated muscle malignant tumor is rhabdomyosarcoma. So that's idea is understandable. Rhabdomyo, it's a striated muscle. Leiomyo is a smooth muscle. Okay, tumors of epithelial origins, the most interesting classification. Okay, stratified squamous epithelia, so causes squamous cell papilloma. It's benign, so it is papilloma. Yeah, remember epithelial cells, benign tumor of epithelial cells, and might be cause squamous cell carcinoma. It's malignant, but sometimes I just yeah. So actually we have basal cell carcinoma. Basal cell carcinoma by classification it's actually same as squamous cell carcinoma, but we distinct it from this because basal cell carcinoma is not dangerous. That's it seems like strange to you, so but basal cell carcinoma are usually never spread out and never cause death. Okay, we'll discuss it. No, we'll discuss it in next semesters. But basal cells, it's usually present in squamous epithelial cells and basal surface of the cells. And but these basal cells, they produce cells outside. They never produce it under the basement membrane, and that's why this basal cell carcinoma. So it seems like malignant. By all features, it's malignant because a lot of cells are produced. But anyway, it very rarely causes the metastasia. Okay, melanocytes. Melanocytes, they became epithelial in origin, but I remind you that melanocytes are derived from neural crest cells. They are neural-like cells, and benign tumor of these melanocytes is present on the skin. They are known as nevus. So just this black plaques we have on the surface of our skin, they are named as nevus. And they sometimes they get malignant, and they form the malignant melanoma. And every melanoma is malignant. So that's why sometimes we just skip the word malignant and we just name it as melanoma. Okay, then epithelial lining of glands or ducts. So benign, it's adenoma. So when entire tumor of gland. Papilloma, when it's present in so special features of papilloma we have, and cystadenoma. Cystadenoma, we discuss what is cystadenoma. And malignant tumors of adenocarcinoma. So when this adenoma is growing too fast and they have tendency for ingrowth inside the tissue. Then when papilloma, so especially in papilloma virus, sometimes papilloma virus became malignant. So makes cells malignant, and they cause a papillary carcinoma. And sometimes they are not related to each other, but papillary carcinoma resembles the papilloma by morphology. And also cystadenoma and cystadenocarcinoma. Cystadenoma is benign, cystadenocarcinoma is malignant because growth is uncontrolled. Okay. Respiratory passages. We have bronchial adenoma and bronchogenic carcinoma. So nothing to discuss here. Bronchogenic carcinoma is different by types. It might be squamous cell, it might be adenocarcinoma also, but just by location we name it as bronchogenic carcinoma. So, and most of, one thing, so you heard about lung cancer. Usually lung cancer, extremely rarely have the lung cancer. Actually we have bronchogenic lung cancer. So tumor used to grow from bronch, than from the lungs itself, from the alveoli of lungs itself. So that's why might be. So I heard sometimes. So one student asked me, might be 3 years ago. So asked me about this. Yeah. So why shouldn't we smoke? Yeah. So smoking doesn't cause the lung cancer. Smoking causes the bronch cancer. Yeah. So that bronchs are sounds easier, yeah, but actually Actually, I explained him that bronch cancer we name as a lung cancer, because actually bronch cancer is replacing the lung tumor, replacing the lung tissue, and that seems like lung tumor, but it's bronchogenic tumor usually in 99%. Then renal epithelium. In kidney we have epithelium, and there might be a renal tubular adenoma and renal cell carcinoma. And renal tubular. So actually we have a lot of tumors in kidneys. A lot of classification is very abundant. But so in easy words, we can all of them are named as renal tubular adenoma. And also we have renal cell carcinoma. Renal cell carcinoma is very dangerous because it can spread from one kidney to another kidney, and it has a genetic predisposition. And that's why if tumor appears in one kidney, so it is possible that later it will appear in other kidney, not by metastatic pathway, but also just by genetical predisposition of kidneys to have the cancer. Okay, liver cells. So it has very rarely have hepatic adenoma, and even rarer than this, we have hepatocellular carcinoma. Very rare condition. Usually, liver. If we heard about liver tumor, so it is derived not from liver. It is derived from all cells of so all tumors of peritoneal cavity. Because you remember that liver collect all the blood from peritoneal cavity into the liver, and we discussed it a little bit in embolism. Yeah, so if clot occurs somewhere in peritoneal cavity, it possibly enters into portal vein, and then cause the obliteration of the portal vein, and that's why liver suffers. But it's a similar condition in metastasis. Yeah, so when we have a tumor in peritoneal organs, so for example, so most common is it's colon tumor. So usually tumor of colon, as a present sigmoid or rectum. We have a tumor there, and usually they give a metastasis into the liver, and that's why if you see liver tumor, so malignant liver tumor, so you have to check the rectum, you have to check the colon of this patient, because possibly primarily it has tumor of digestive tract. Okay, urinary tract epithelium. So this is one of the most dangerous tumors, the transitional epithelium. Transitional epithelium, you remember it's a stretchable epithelium. It's very rarely gives a papilloma, very rarely. So usually so when you see some growth in transitional epithelium, some growth in respiratory tract, in urinary tract, we always suspicious for cancer. We always suspicious for cancer, and this is causing transitional cell carcinoma, and it is one of the most aggressive tumors in our body. So, and they spread along the urinary tract, and first of all they cause the kidney cause the kidney failure first, because it obliterates the normal passage of urine, but also very very malignant and can spread out all over the body in very fast way. Then, and it has very poor treatment we have. Then placenta epithelium, so very rare benign tumor is hydatidiform mole, very rare, but more commonly we have choriocarcinoma. So it's so it happens in some cases when fake pregnancy happens. So when according to tests of along with in pregnancy test we see the HCG positive, human chorionic gonadotropin positive, but tumor is invading inside, so from the baby. So actually it is related to sexual contacts, and when the patients try to get pregnant. That's increase the severity of this disease. And increase the sudden sadness of this disease, because choriocarcinoma. So usually in case of choriocarcinoma, we must remove the uterus, and patients who try to get pregnant, they can leave this opportunity. And in testicular tumors, we have seminoma and embryonal carcinoma. We have so very wide classification of these two, but seminoma, so it's a tumor of sperm producing cells, and embryonal carcinoma, so it's maintenance cells tumor. More than one neoplastic cell type, mixed tumors, they derive from one germ cell layer. It's salivary gland. It's named as, so salivary gland can give us pleomorphic adenoma. It's or malignant mixed tumor salivary gland origin. So they are different. And renal enlarge. It's known as a Wilms tumor. So what is it? It's a topic of kidney discussion. And totipotential cell in gonads or in embryonic arrests, it's causes a mature teratoma, dermoid cyst, or immature teratoma, or teratocarcinoma. So very rare condition when teratoma causes teratocarcinoma. Okay, and now we'll discuss a little bit about characteristics of benign malignant neoplasm. So, and after this, I will let you go. Okay, benign and malignant neoplasm. So let's check a little bit. So, and here are two characteristics of first division of benign and malignant neoplasia is that first of all it's their differentiation. So you remember what's the process of differentiation when one cell doesn't resemble another cell. When one cell gets some genetic factors which cause the changing of their changing of the metabolic rate, maybe changing of metabolic weight or activity of the cells are changed. It is differentiation in a way of in discussion of in the way of discussion about tumor. In way of discussion of normal cell, but in a histological view, when we observe the cells, if we can differentiate the cell from other cell. So when in pathology examination, you see that one cell, yeah, it resembles a normal cell. So you can say, oh, it's differentiated cell. But we have the stages of loss of differentiation, and loss of differentiation is given by process known as dysplasia. So now, okay, later to be discussed. Okay, what is differentiation? So well differentiated cells are usually benign. Well differentiated cells are very usually benign. But if cells are very hard to differentiate one from another, we have dysplasia, and in some organs we have dysplasia first dysplasia, second dysplasia, and third dysplasia type class. And level of dysplasia is present. And when tumors cannot be identified, when it's lost all the differentiation, it is known as anaplasia. And I said to you, less differentiated cells or anaplastic cells, they are most dangerous cells in treatment, because they have no restrictions in cell division. So take a look. For example, this leiomyoma of uterus. You see, these cells which are present here, they resemble the smooth muscle cells. They are normally smooth muscle cells. Absolutely normal. It has no specific features. It is same containing the nucleus, containing the actin and myosin here. They are benign. Yeah, that's the definition of benign tumor. But if we move Yeah, okay. Here also benign tumor of thyroid gland. So you remember, maybe you remember the histology of benign histology of thyroid gland. You remember it has cysts, but you see, cells are differentiated. So still we see cysts in thyroid gland. Yeah, they are different in size. Yeah, they are a little less. They don't seems like normal cell. But if you individually observe one cyst here, so it seems like normal part of tissue. That's why it's called as benign tumor. That's named as adenoma. And also here, for example, squamous cell carcinoma of the skin, it is present here when you remember that what is the uh, you remember the stratified squamous keratinized epithelium, yeah, and that upper part of this epithelia get keratinized, yeah, keratinized. And in cases of squamous cell carcinoma, so this keratinization happens inside the tissue, so inside the epithelial cells, in between the other epithelial cells. That it's strange thing, so it shouldn't be this way, but it shows that these cells are crazy. Yeah, the cells are cannot produce it properly. That's why we see this by arrow. We see this well differentiated squamous cell carcinoma. So, but take a look here. This anaplastic tumor. You see, in anaplastic tumor, what we would see? What is this nucleus? We can't understand what is this nucleus. So what's the shape of this nucleus? Shape is absolutely strange. So here, yeah, so it's very small nucleus, small heterochromatic nucleus, but nearby we have very large euchromatic nucleus. So sometimes it's very small, sometimes very large nucleus. So even here we have a giant nucleus. Here we have large nucleus, yeah. So but here is this nucleus is shrinked, yeah. And you see, it's known as anaplasia. So first of all, we pay attention to the size of nucleuses, size and shape of nucleus. So this is this when nucleus shape is changed. So we have a okay. Let's talk about pleomorphism. So pleomorphism is when cells are different. So cells are different. They don't resemble the normal tissue, and some cells are very large, some cells are very small, and they can form tumor giant cells. You remember we had giant cells, Langhans cells, yeah, in case of tuberculosis, but this is tumor giant cells present. Tumor giant cells when cells are divided. So you see, main point of malignant growth is when growth, so when cell division goes without control, and sometimes endomitosis happened, and then nucleus is not divided, so and you see cell size is changed. So you see here, this is grand cell, not typical for normal cell tissue. And then of course abnormal nuclear morphology. First of all, we care to nuclear to cytoplasm ratio. Nuclear to cytoplasm ratio is changed, so it's okay, it's well differentiated. Oh, okay, like this, yeah, for example, like this. So normally, so we have usually you have to know what the normal, how normal tissue looks like, and then you compare it, yeah. So you remember that this cell should have small nucleus, yeah, approximately so nuclear cytoplasm ratio is 1 to 6, yeah. But here you see that half of cytoplasm is replaced by nucleus, and even nearby you see the cells with the small nucleuses. You see, it's a very its nuclear changes are present, obviously present here. And this is the giant cell of tumor. So when cytoplasm, they are known syncytial cells are formed. They are present because cytoplasms of the cells are split. They are split and form the giant cells. Okay. Then mitosis. So usually mitosis is very rare process in our body. So relatively rare. But in malignant tumors, so they contain a lot of many cells in mitosis, because rate of mitosis is very increased, and they can form atypical bizarre mitotic figures. So let's check the 7.8. So here it's not well shown. Why is they shown it here? So here, if you're watching, so here it's not well shown. So, but if you watch it in real book, so you can find this. Bizarre mitotic figures. Loss of polarity. So in case in epithelial cells they possess polarity, yes, that we have apical domain and basal domain, and when when it's mixed up, so it's named as loss of polarity. So that's they have disorganized fashion, because epithelial cells are very well organized, but here we have disorganized fashion. And we have other changes which are typical for different types of tumor. Specific features are present in every tumor, and that's what oncologists are talking about. Okay, and of course now it's easier to explain what is a metaplasia, dysplasia, and carcinoma in situ. So metaplasia. So you remember metaplasia, we discussed it. It's when one cell type, one tissue type is replaced by another cell type, and metaplasia is nearly always found in association with tissue damage, repair, and regeneration. Metaplasia is it's a reflection of our body to some injurious stimuli, and examples are Barrett's esophagus and squamous cell metaplasia of respiratory tract. Yeah. And Barrett's esophagus, but sometimes this metaplasia can undergo to dysplasia. It's very close process, metaplasia and to dysplasia, and then this dysplasia causing the tumor. Okay, dysplasia is a term that literally means disordered growth. So when growth is disordered, so when one cell doesn't resemble another cell, so when differentiation is damaged, this is dysplasia. And we have dysplasia type 1, dysplasia type 2, then we have different classifications of tumors according to dysplasia. And usually when we talk about dysplasia, sometimes we can say that it's benign tumor, but sometimes dysplasia causes a malignant tumor. Okay, carcinoma in situ. So what is carcinoma in situ? So it's our desire of all oncologists is to capture carcinoma in situ in patients. Carcinoma in situ, it's a carcinoma which is not carcinoma yet. Yeah, so it is not cancer yet. So when dysplasia is severe and involves the full thickness of the epithelium, but the lesion does not penetrate the basal membrane, it is referred to carcinoma in situ. So, and the desire, once again, the main desire of oncologists to find carcinoma in situ and remove it from the body, because you see, it doesn't grow inside the tissue. It doesn't affect some connective tissue yet, and doesn't spread yet, and we can remove it without any consequences. So this is a real desire, so really passion of all the oncologists to find carcinoma in situ and to detect carcinoma in situ in every patient, and to treat this patient in the very beginning, because usually we can easily destroy this carcinoma. Okay, what is a local invasion and metastasis? We'll start to discuss in next class. Okay, thank you. So let's check your attendance. Any questions? Do you have any questions?
Sir, passing marks of the test, sir.
Marks of the tests?
Yes, sir.
I thought you knew it. Okay, I'll check it from our IT specialist. He will he will announce it, I guess. So it will be some table, I guess. It's automatically should given to you.
Okay, sir.
Any more questions regarding this topic?
No, sir.
No question, yeah.
Sir, when will we remodule, sir?
Remodel. I don't know. So I don't know. Do we have remodel itself or not? So I don't know. Okay, thank you. See you next time. So everyone who wrote your name in chat is present. Everyone else is
Sir, how module marks will be calculated?
one answer, 1 point. That's it. Okay, thank you.
Thank you, sir.
Goodbye.